The human body is a complex and intricate piece of engineering in which every structure plays a precise role. There are approximately 2,000 bones, 650 muscles, 79 organs, and enough blood vessels to circle the earth twice. Medical schools typically teach anatomy of these structures in approximately one academic year. However, what does human anatomy actually entail? In this article, we will take a look at what this subject means and how you can tackle it in the most logical way. Basic and terminology. First thing first, what is anatomy and where did it all begin? The term anatomy derives from ancient Greek means dissection or to dissect and involves the study of the structure of the human body. This 2000-year-old scientific discipline sprung to life in ancient Egypt and was increasingly developed across the ages by anatomy heavyweights like Galen, Leonardo da Vinci, Vesalius, and many others. Learning such a complex subject can only be accomplished by taking small and logical steps. What's the best place to start? By mastering the basics such as direction, movements, body plans, and overall anatomical terminology. In a nutshell, their main anatomical planes divide the body into frontal, lateral, and transverse views. These views showcase the position and relation between anatomical structures, which are described by precise terms, for example, superior, inferior, lateral, and many others. Movement can also be described by standardly accepted terms such as flexion and extension. With this vocabulary up over the sleeves, it's time to dive deeper into subject and find out more about its learning approaches. Human anatomy consists of two main divisions: microscopic or gross anatomy, microscopic anatomy. Feeling brave today? Jump into your first quiz about the directional terms and body plans of human body. Regional anatomy. Let's begin by taking a look at microscopic or gross anatomy. As the name suggests, the branch deal with the large structures that are mostly seen with the naked eyes. It describes where every human body structure is located, topograph, similar to how a geographic map of an area shows all the landmarks in a particular parameter. Not only that, but it also describes how to structures and connected to each other, their starting and end points, their layering, and so on. There are two fundamental approaches to studying gross anatomy, and regional and systemic one. Regional anatomy organizes the body into several body parts or regions: upper limbs, lower limbs, trunk, legs, abdomen, pelvis, back, head, and neck. This approach divides teaching and learning into discrete, discrete regional didactic area, each one containing its respective bones, joints, muscles, arteries, veins, nerves, lymphatics, and organs. Let's like a look all these regions and learn some basic about each one. Upper limbs. Let's begin the talking about the extremities and structure responsible of interacting with the environment, locomotion, weight bearing, and many more. The upper limbs consist of four main parts: shoulder, arm, forearm, and hands. And turn the mobility of the limbs is provided by the shoulder, elbow, and wrist joints onto which various muscles act. However, their action depend innervation and their viability on proper nutrition and blood supply. Do you know the name of vein punctured by needle? When you have your blood drawn, how about the name of the nerve that can lead to tingles? If you lean on your elbow for a long time, lower limbs. The lower limbs has four main parts called hip, leg, and foot. The flexibility is provided by the hip, knee, and the ankle joint, which allow you to kick, jump, squat, and shake it on the dance floor. The lower extremity consists some of the most powerful muscles in the human body, which is organized into various compartments. Significant vessels like femoral artery and the longest nerve in the human body, the sciatic nerves, supply the limbs.